Hi, my name is Marcus Cupola, and I'm a registered psychotherapist. You might remember me from such assistance videos as Pull My Finger and Don't Eat That Worm. I wanted to talk to you today about speaking to someone who has or may have thoughts of suicide. Now, this video is not meant to replace a training program, nor is it meant to cover all the information that would be appropriate for a professional. This video is aimed at giving the basics to somebody who knows nothing about talking about suicide and wants to know, well, what do I need to cover? So this video will cover just the basics for what to assess in somebody else if they have thoughts of suicide and how to broach those questions. So at the very beginning, we have to start the conversation somehow, and we're often tempted to avoid speaking about suicide. In the previous video I mentioned we're worried about giving them the idea, but also it's because we, the speaker, are uncomfortable with the subject. It is best to approach this head on and ask something like, I'm concerned, are you having thoughts of suicide or self-harm? And we also want to include asking about self-harm because suicide and self-harm often go together within somebody who is distressed. So we just want to come right out and say it. Are you having thoughts of suicide or self-harm? And it's okay to approach that. If we are roundabout with our approach and say, well, I'm wondering if maybe you're having some thoughts of going away or not being here. And you notice that I've started to look away. I'm indicating that I'm uncomfortable with it. And when I don't come right out and say suicide or self-harm, I'm subtly giving the other person the impression that I'm not okay to talk about it and I don't want to talk about it. And as a good person will try to do, especially somebody who's in pain, who generally does not want to burden somebody else, they will simply be good people and say, no, I'm not. But what they're doing is they're trying to save you from having to talk about their feelings. So you want to come straight to the point. That also gives them permission to talk about it. That gives them permission to say, yes, I am having thoughts of suicide. So come straight to the point. The next thing that you want to do is check and see, do they have a plan? So if they have thoughts of suicide, thank you for telling me. Do you have a plan to complete suicide? And they will tell you if they have a plan. And if they have a plan, you want to ask all the details of the plan. Specifically, what you want to do as the speaker, as the person who's caring and wants to know more, you want to check for a current plan. You want to check for past attempts. If they have a current plan, you want to check for, do they have access to the materials? Do they have a time frame? Do they have a location? So all of these indicators tell you how severe or how much more likely it is that they will complete suicide. So if they have a plan, and it's to use pills, for example, and they have access to the pills, and they've chosen a time, then that indicates a very high risk. If they don't have those things, it's still okay to talk about. However, you know that they are at lower risk for completing suicide. That does not make their feelings any less important, but it does lower the risk that they are going to complete suicide in the immediate future. This is valuable information to you because it gives you an understanding of how safe they are. The next step in the process then is to do some safety planning. Even if they don't have a plan, past attempts, access to resources, or a plan to access resources in a time, you still want a safety plan. Okay, well, the next time that you have thoughts of suicide, what will you do? Who will you talk to? And if they don't have a plan, you want to help them create one. Well, I can call my mother, or I can call my brother or sister, or I can call my friend. And you want to have as many layers to that as possible. If that person's not available, who will you call? Okay, if this occurs, what will you do then? And you also want to include some resources that they can access at any time, such as calling a crisis line, where they're trained to handle thoughts of suicide, and they're there at 3 a.m. if somebody can't sleep. Also, you want to have a last-ditch effort, so to speak. So if none of those occur, it's always okay to call 911. If they call 911, they can ask for assistance, or if they feel that they're going to complete suicide, calling 911 is the way to go. If they have all of those risk factors that we discussed earlier, then it's okay for you to call 911. This is called an imminent risk because they are most likely going to attempt suicide. So you call 911 and ask for an ambulance. An ambulance is required to attend. And you want an ambulance because an ambulance will bring them to a hospital. Whereas not all police know what to do with someone who has thoughts of suicide. So it's okay to call 911 and have the ambulance take that person into their custody. Ultimately, we would rather have them be alive and angry at us than for them to complete suicide and no longer be there. So that puts together all the very basics of what to do. We want to ask directly about thoughts of suicide and self-harm. We want to check for a plan. We want to check for past attempts. We want to check for the specificity in the plan. Do they have a timeline? Do they have a place or a location? Do they have access to the resources if they're planning on using resources? Then we want a safety plan. We also want to know that it's okay to call 911 at times. So that's all the very basics. A couple other things that I do want to put in there are a couple of things to avoid that can interfere with the process. Near the top of the list is giving what's called a false platitude, saying things like, it's going to be all right, because it might not be all right. Many situations in life are not going to be okay. Many things in life are not going to get better. So we want to avoid giving false platitudes. That's invalidating and will actually push them away. Might actually upset them more, make them angry and not want to talk to you. Another thing that we want to do, we want to avoid saying something like, I know how you feel. Maybe we do know how they feel, maybe we have been there in the past, but it's invalidating for them because in that moment, you are not inside their head. So you're not feeling exactly what they feel at that time. So what we want to do is simply tell them that we're there for them. I'm here for you. And when they say you don't know what it's like, ask them what it feels like. Explore their world with them. You're right, I don't know what it feels like. Can you tell me? I would like to understand. When I express interest and empathy, they're more likely to talk to me. Also, I'm not invalidating. You're right, I haven't been in your shoes. I haven't been in this situation. Tell me about it. That helps them talk more. That helps them feel listened to. That helps them de-escalate. And your goal is not to solve the problem. Your goal is to try and keep them alive. That's why you're asking about it. And that's why you have such things as a safety plan and calling 911. Alright, so I'm going to wrap there. I believe I've covered the most important basics. Thank you very much for watching. Please remember to like, share, and subscribe. And we'll see you next time. Thank you.